I'm speaking with Drs. Donna Broad and Jack Cottrell about the recent experience with the Humanitarian dental mission in El Salvador. Jack, Donna, what's it like to do a day of dentistry in a humanitarian mission?
Well, it starts early. I mean, when we do one of these missions, you are up before the crack of dawn. And you have a quick breakfast, and our captain, Dr. Jack Cottrell, always makes sure that we are staying in a safe place that will serve us good food and where we can have a clean area to sleep and get cleaned up. Because without that, we would not be able to continue day after day at the pace we set. So after a quick breakfast, we load up into the van with all of our equipment and everything necessary, and off we go to our location. At the location, it may take us 45 minutes to an hour to set up properly, and as we arrive, we already see the lineups of people ready for us to take care of. Immediately, we have someone that might start doing a little bit of triage, but there's always a patient in need immediately. So they sit in the chair, we can assess the situation, and we begin treatment. And our goal is to see everybody that's in line. So no matter what it is, we try to do dentistry the best way we know how we were taught, with the gifts that we were taught in dental school and that we've learned through the years. And we will do everything. We do scaling if that's the biggest problem that they have. We do oral hygiene. We do amalgams. We do composite resins. We do extractions. We do limited endodontics. And in a lot of cases, if a patient, especially a young girl, is missing a front tooth due to an accident or trauma or decay, that's simply replaced with a composite resin bridge to make them look good and feel good about themselves.
Jack, would you just tell me about that most recent visit to El Salvador? How long were you there? How many were there? What types of services were provided in that Spear-Away mission?
Yes, our most recent one, there were 7 dentists, and over the period of 8 days, we treated 1,050 patients. Donna had mentioned the treatments are sometimes very onerous. They're very extended. There's no such thing as one filling, one person, but in essence, it's an exhausting yet exhilarating experience. It is not the types of conditions that we're used to working in terms of backdrop, but also, as Donna has mentioned, we do the very best dentistry you can imagine in those clinics. When we see these patients that are waiting for us in huge lineups, if you look in their eyes, you look at the need in their eyes and you see it, I think that's probably the thing that sells you and gives you the most exhilaration. And if there was true happiness, that's it, being able to help that person at that point in their life when they're looking at you and saying, why are you even here? And yet you are a saint in my mind. And then, of course, the little children. And I think there's nothing that is more meaningful than helping a child and showing them love and showing them that if they grow up with love, that they will be able to give love in return. And I think that is important for their future and how they will look at life as they go on. So these are the bigger pictures mixed into the on the road, on the ground work that we do, but it's all wrapped up part and parcel of each day's work.
And the day goes by so fast that the time that you're serving these patients, the 8 hours is gone.
It's gone, yeah.
Right. So you clearly enjoy your involvement with these humanitarian missions.
Exactly.
Oh, yeah.
And the appreciation, the hugs at the end when they look in the mirror and they see their smile restored. Instead of hiding behind their hand when they laugh and smile, they can smile a full smile again and interact socially with their peers. That means as much to them as it does to you and I, and there was no way before they went in that lineup that they could have ever imagined that that would happen.
And the people are so grateful for any and all treatment.
Clearly, patients benefit, you benefit, the dental profession benefits from involvement with this.
And I think Canada, too, because we do have the Canadian flag.
Lovely. And you're there with other professionals. There's medical services and pharmacists.
Yes.
So what can an individual Canadian dentist do to support such humanitarian missions? What's the first step that I or any of my colleagues can take?
I think a willingness to turn around and look at someone and help them. And I think it starts in your own backyard. It starts in your own patient group. It starts in your own community. And try it once. It's kind of like this random act of kindness, but try it and see what you feel like. And then extend yourself from there, and you'll find that true happiness comes from helping other people, and not from trying to go out and buy the biggest car or the next biggest TV, but it really is from helping people.
And really, I think in Canada, most of us provide dental care to underserviced individuals on a daily basis.
Yes. Yeah.
Mm-hmm.
So for missions like the one you've been on, what organization should I contact?
I think if you go on charitable organizations and Google along with Dentistry, I mean, Fairway is a great spot to start. ICD is a great spot to start because with ICD you can almost pick the country you want to go to. They've got a very broad base, and they will be able to hook you up with individuals that are doing missions at that level. But you can Google it, you can phone any of us, you can email us, and we will get you hooked up with the right something that works for you.
What can organizations like the Canadian Dental Association and dental schools do to support such humanitarian missions?
I think they can better communicate what is going on in terms of volunteerism, how people can get more involved, and try to also work with models of care to try to standardize how these humanitarian efforts are being delivered. And also, I think taking a step back and always thinking of dentistry as not just a silo unto itself. We view the success that we have in Fairway with the idea that we are dealing with the overall health of the individual, which is what we talk about in dentistry every day. But we're working with doctors, we're working with pharmacists, we're working with paramedics, nurses, and dentists working together to deliver care.
Yep.
And I have never seen more respect given to dentists than the respect that physicians give us in the field when we're working in these areas of high need. They really do appreciate and truly understand the importance of dentistry and oral health in the scheme of general health.
Well, congratulations to you both for your involvement, and anything we can do to support you, we're here to do that. And we look forward to learning more about your next mission. Thank you very much
John.
for the interview.
Thank you, John.
Thank you. Thank you, John.